It's weird. I had a feeling before all this happened that I was gonna die young. And I did. But I came back.
In Sean's case, he was transferred from an outside hospital where the diagnosis of a pulmonary embolism had been made. He had presented there with sudden onset of shortness of breath and a little bit of lightheadedness, which is often the sign that heralds a pulmonary embolism. When he arrived at Mass General to the emergency department, a PERT activation was called.
We established the Pulmonary Embolism Response Team, or PERT as we call it, a few years ago, really because we recognized that patients with large pulmonary emboli, or life-threatening condition, maybe weren't getting optimally managed. So this was an attempt to really try to coordinate and facilitate the care of these patients.
So what we've done at Mass General Hospital in the Fireman Vascular Center is create a team of doctors from multiple specialties who get together in a very rapid response type of environment to figure out what's the optimal treatment for a patient with a pulmonary embolism.
It allows an emergency physician or a medical physician to have a single number they can call where you can get a consensus opinion of 5 or more people.
We had the entire team up in the cath lab ready to receive Sean, and we called down to the emergency room and told them we're ready, transport him up, at which point I was told he just crashed.
I did die in the emergency room. That's when the blood clot broke off from my lungs and entered my heart.
There was active CPR going on. We ran down with the entire team, the perfusionist team, the cardiac surgeon, myself, and put him on a heart-lung bypass machine. Sean was the beneficiary of this PERT activation and this PERT team and this whole approach that we've taken at Mass General Hospital.
I guess this team, the ECMO unit, is very dedicated. I don't know, it's like the bat signal or something.
The Fireman Vascular Center is a multidisciplinary center involving everybody that treats every kind of vascular disease from head to toe. Sean's was one of the more dramatic cases that we've seen, no doubt. It's such a gratifying thing to be able to see these patients and treat them in a multidisciplinary way and know that we're doing the very best that we can for these patients.
I see the world differently after this experience. I feel that I have been given a second chance at life, and with that second chance, I've put more effort into my photography. I've had a solo show at the Griffin Museum of Photography where we are now. I've always had the attitude that you get knocked down, you gotta pick yourself up and keep going. But it's a good reminder that somebody out there is watching out for me.